Why is my dog vomiting worms? A vet-reviewed guide to causes and treatments. It can be incredibly distressing to see your dog vomiting, even under normal circumstances. However, noticing worms in the vomit elevates concern to a whole new level. Worm infestations are a common issue in dogs, with the most prevalent types being roundworms, tapeworms, and hookworms. While the presence of worms in your dog's vomit might suggest they are the direct cause, this isn't always the case. Many dogs harbor intestinal worms without any outward signs, and the first indication of an infestation might be the discovery of worms in vomit or feces. Regardless of the underlying cause of vomiting, addressing worm infestations promptly is essential for your dog's recovery and overall health. ### Common reasons for dogs vomiting worms. ######1 Roundworms, ascarids. Roundworms are among the most frequently encountered intestinal parasites in dogs, especially puppies. They are typically transmitted from the mother to her offspring, either in utero or through the mother's milk. Roundworm infections may go unnoticed in many adult dogs but can severely affect puppies, causing significant weight loss and a pot-bellied appearance. ############################################################################################################################################################################################################################################################################################################################################################################################### infected feces, soil, or small animals such as rodents or birds carrying the parasite. Puppies are particularly vulnerable, often contracting worms from their mother. ######## Signs of infection. Common symptoms of roundworm infestations include a swollen or distended abdomen, vomiting and diarrhea, sometimes containing visible worms, poor coat condition, weight loss despite an increased or decreased appetite. ######prevention. To reduce the risk of roundworm infection. Deworm pregnant dogs before and during pregnancy. Deworm puppies starting at 2 weeks old, then again at 5 and 8 weeks of age. Dispose of dog feces promptly and prevent pets from eating wildlife or scavenging. ######treatment. Treatment usually involves oral deworming medications. Puppies typically receive liquid dewormers every few weeks, beginning at 2 weeks of age. Adult dogs benefit from routine deworming schedules every 3 months or as advised by a veterinarian. While effective, deworming doesn't guarantee the immediate elimination of all parasites, so fecal testing may be recommended to confirm treatment success. ######2. Tapeworms. Tapeworms are flat, segmented parasites that attach to the small intestine of dogs, feeding off nutrients from the host. The presence of small, rice-like segments, proglottids, in the dog's feces or around their anus is a telltale sign of tapeworm infection. ######causes. Tapeworms are most commonly transmitted through the ingestion of infected fleas or small prey such as rodents. Each proglottid segment released into the environment contains eggs, which can be consumed by fleas or other animals. #####signs of infection. Indicators of tapeworm infection include scooting or dragging the rear on the ground, caused by irritation from proglottids. Visible segments around the anus or in bedding, resembling grains of rice. In severe cases, weight loss, and a dull coat. ########################################################################################################################################################################################################################################################################################################################################################################################## Use flea prevention treatments regularly. Restrict access to rodents or other wildlife. Clean up after your pet promptly to minimize environmental contamination. ######## treatment. If your dog is diagnosed with tapeworms, your veterinarian may administer an injection or prescribe oral medication. Regular deworming and flea control are critical to preventing reinfection. #######3. Hookworms. Hookworms are small, blood-feeding parasites that attach to the intestinal lining. Although not easily visible in vomit, they can cause severe health issues, especially in puppies. #######causes. Hookworm infections can occur when a dog ingests contaminated soil, feces, or larvae. Puppies can also contract hookworms through their mother's milk. Additionally, larvae can penetrate the skin, entering the bloodstream and migrating to the intestines. ####### signs of infection. Hookworms may cause vomiting and diarrhea, often dark or tarry due to intestinal bleeding. Lethargy. Anemia, particularly in puppies, due to blood loss. ######prevention. Measures to prevent hookworm infection include deworming pregnant dogs before mating and during pregnancy. Maintaining hygiene in the dog's living environment. Avoiding contaminated areas and soil. ######treatment. Treatment involves oral or injectable dewormers effective against hookworms. Puppies should follow the same deworming schedule as for roundworms. Regular fecal testing ensures that the treatment has resolved the infection. ###when to see a veterinarian. Although over-the-counter deworming medications are available, consulting a veterinarian is the safest and most effective way to treat worm infestations. A vet can identify the specific type of worm and prescribe the appropriate treatment. Additionally, they can rule out other potential causes of vomiting, such as dietary indiscretion, infections, or chronic conditions. If your dog continues vomiting, refuses to eat, or shows signs of lethargy, a veterinary visit is imperative. #####addressing worm infections in dogs. #####can I treat my dog without visiting a vet? While some non-prescription dewormers can be effective, they are not always reliable. Incorrect treatment may prolong the infestation or fail to address the specific type of worm. A veterinarian's diagnosis ensures the correct medication and dosage. #####, can humans contract worms from dogs? Yes, certain types of worms, like roundworms and hookworms, can infect humans. Roundworm eggs can be ingested inadvertently, particularly by children playing in contaminated soil. Hookworms may penetrate human skin, causing a condition called cutaneous larva migrans. Maintaining proper hygiene and regular deworming for pets helps minimize these risks. #####, should I disinfect my home if my dog has worms? Disinfecting areas where your dog spends time is a good practice. Clean bedding, sanitize floors, and dispose of feces promptly. Regular flea control can also prevent tapeworm infestations, as fleas are an intermediate host for these parasites. Summary. Intestinal worms are a common but treatable problem in dogs. Puppies are particularly vulnerable and should follow a strict deworming schedule from an early age. Symptoms of worm infestations vary but often include vomiting, diarrhea, weight loss, and a dull coat. Treatment involves targeted dewormers prescribed based on the type of worm identified. Preventative measures, including flea control and proper hygiene, play a crucial role in reducing reinfections. If you notice your dog vomiting worms or displaying other concerning symptoms, consult a veterinarian promptly to ensure the best course of action for your pet's health.